Hello, everyone, and welcome to our community conversation event for September 10, hosted by the County of Marin and Marin Health and Human Services. I'm Lainey Hendricks, Public Information Officer for the County of Marin, and I'll be your moderator this afternoon. It's great to be with you again, and a lot has happened in the few weeks since our last community conversation. The governor introduced a blueprint for a safer economy, which replaces and expands the former county monitoring list, further slowing the pace counties can pursue reopening. While it seems like many Marin businesses would finally receive the green light to reopen indoors, the state pumped the brakes to further evaluate Marin's data based on new methods for calculating the county's ranking within the blueprint framework. And so today's event is appropriately titled COVID-19, Where Are We Now? Before we dive in, I want to remind you that you can find the latest information about COVID-19 activity in Marin County, including health order guidelines, testing information, mask wearing do's and don'ts, and more information by visiting coronavirus.marinhhs.org. On that webpage, you can also sign up to receive our daily updates, which contain an overview of confirmed case data and other updates about Marin's response to the COVID-19 pandemic. To receive those updates by email, visit coronavirus.marinhhs.org/subscribe, or to receive updates by text message, simply text the phrase Marin space COVID to 468-311. For today's event, we've invited two of our top health experts to provide an update for you and answers to the questions that were submitted by our viewers before the start of today's broadcast. Benita McLaren, Director of Marin Health and Human Services, joins us today. Welcome, Benita. And we're pleased to have back Dr. Matt Willis, our Public Health Officer and leader of Marin's Public Health Division of Marin Health and Human Services. Welcome, Dr. Willis. Dr. Matt and Ms. McLaren, I'm going to go ahead and turn it over to you to kick off our event today with a quick update.
Great, thank you, Lady. And Jason, if I could have my slides, I'll offer an update on our status of where we are right now as a county for COVID-19, and then get into some of what Lainey had mentioned regarding the new California blueprint and how that relates to our status in Marin. Next slide, please. Just want to start by orienting us to the principles that we're applying to all of our thinking and practice with regards to the COVID-19 response. And it's orienting to the broad definition of health that we look to within the Department of Health and Human Services, which derives from the World Health Organization definition, which is health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. And we think this is an important framework for us, or an important organizer of our thinking and our strategy, because we recognize that we are continuously balancing risks, harms, benefits across a variety of domains, both in terms of infection control, but also socially, in schools, developmentally, educationally, in the business community, in terms of the economy. And we need to see these things as holistic rather than merely focusing on the interruption of COVID-19 transmission. Next, please. This is the overall experience from Marin over time since the beginning of the epidemic. Our first case was in the beginning of March. We have now 4,130 cases, and that's 2 days ago. So there's even a little more today. Next, please. This summarizes our experience. We've tested over 73,000 residents. Over almost 4,000 have recovered from COVID-19. We have 142 people who have ever been hospitalized in the county, 73 total deaths. We separate this data out to capture some of the most important features of the long-term care facility experience. We know that many of our cases are in that more vulnerable setting. So if you look on our website, and any of the data I'm sharing incidentally is available on our website publicly, This is I'll summarize the experience in the long-term care facilities. We've had a total of 418 positive residents in facilities. There are currently 23 residents who are infected in those facilities and 29 staff. 63 residents of long-term care facilities have passed from COVID-19 infection, which make up 86% of countywide of all deaths that have occurred in Marin County are people who reside in long-term care facilities. Next, please. When we talk about flattening the curve, this is the curve. This is the number of daily cases of COVID-19 since the beginning. And what if you sort of step back and look at this, what you can see is that there's a clear arc here where we saw increases in cases starting in early May after the very restrictive shelter in place that we launched in mid-March began to be lifted in May, and you see a corresponding and predicted increase in cases all the way through our peak in mid-July. And yet, as mid-July progressed, we did continue to have reopenings. And yet you see case counts dropping, and that's a sign that we can do this. That's a sign to me that that we've learned how to protect ourselves amidst reopening by our own personal behaviors, with physical distancing, covering our faces, washing our hands, refraining from engaging in social activities and being around others if we're sick, combined with an aggressive testing strategy, contact tracing, and working with our healthcare partners to ensure that people are identified early as possible and isolated and quarantined. Next, please. This is just a further demographic description of our incidents. What you see on the far left there is the overall distribution by age for our county as a whole. And what's important there is if you look at the green bars at the top of those columns, it corresponds to individuals who are age 65 or greater. Fewer numbers of cases are actually compared to the population for those older age, but a higher proportion of those that are hospitalized, and almost all of our deaths, 96% of the deaths in Marin County are among people who are age 65 or greater. Next, please. This is also an important feature of our experience of this epidemic, which is the racial and ethnic distribution of cases relative to the population. On the far left, you see that our population is 75% white, 16% people who identify as Hispanic or Latino, and yet 70% of the cases are among people who are in our Latinx community. Next, please. This is an important indicator of, we've been talking about case rates. This is hospitalization rates. And I think in many ways, this is an even more important descriptor, because at the end of the day, what we're trying to do is prevent people from becoming very sick and passing. And we want to compare, if we're looking at rates comparatively across the region, we also want to look at hospitalization rates comparatively across the region. And what this shows is that while Marin may have higher measured rates than some other counties, we have lower hospitalization rates. And that's a sign that we're ascertaining cases earlier on and helping prevent people who are infected from coming into the hospital. Next, please. This is the California blueprint that Lainey was mentioning. This is the new governor's framework. This is the numbers as of today, where there's about 35 counties who are in that most restrictive category. It's a 4-tiered framework. Tier 1 being the most restrictive, corresponding to counties with the highest burden. Tier 4 being least restrictive, most open, corresponding to counties with the least amount of transmission. Right now, the majority of counties in the state of California are in that Tier 1. We are in that Tier 1 this week. We had anticipated being in Tier 2 this week. That decision was reversed by the state at the last minute on Monday. We did not move forward into Tier 2, and I'll explain more about that. Next, please. These are the metrics, the indicators the state has put forward to determine which tier counties fall into. In that highest purple tier, it's more than 7 daily new cases per 100,000 residents measured over a week interval, and requiring a percent positivity of tests of less than 8%. We are on the cusp in terms of our numbers between that purple category and the red category, substantial, which would correspond to 4 to 7 cases per 100,000 residents on average over a period of a week, and 5 to 8% positivity. Our percent positivity is closer to 3 or 4%, but our case rates are closer to in that between the substantial and the widespread. Next, please. So these are the key features of the new blueprint. It is statewide. There are mandatory metrics for all counties. I just went over them, the case rates and test positivity. 2 simple metrics that are easy to measure and follow. 4 categories instead of 58 sets of rules. Previously, there had been a wide range of different practices and policies and procedures across the state. This is one effort to standardize that with clearer guardrails offered by the state, and counties are functioning under statewide orders. It is a slow process. Any county, it needs to be at least 21 days in any tier before advancing, except at the start. It's incremental. Sectors progressively move to more open operations in each tier. So you might open restaurants, for example, at 25% in tier 2, and then in tier 3, that expands to 50%. So it's more elastic and it's more nuanced in that sense. And then it is also responsive, where there's metrics tied to closing back down. If you spend at least 2 weeks sequentially with incidents that corresponds to a more restrictive tier, you move into that tier. And so there's both moving forward and moving back has been clarified. Next, please. This gets to what our experience was in Marin County last week, when there was a last minute change in our status from being red to purple. What the state does, it looks at weekly rates of cases. And so this is a little blow up of that epidemic curve I shared of all of our cases per day over the month of August, and the 7-day frames that the state looks to determine which tier we fall into. Look at that, from 8-9, the 9th of August to the 15th of August, our rates corresponded to the red tier. Similarly, the following week, in week 2, our rates corresponded to the red tier. It was at that point that the state signaled to us that we were headed towards a red designation at the end of week 3. However, on that week, we experienced, if you look at the 25th of August, one anomaly where we had a higher number of cases on one day. That was associated with a specific outbreak that occurred in a long-term care facility in Novato, where we went and tested every single resident. 41 residents were infected, and that affected the case rates for that particular week, especially since, and I'll get into this, there was a statistical issue with a correction factor where we have where we take testing rates into account. And so the solution with the state that has been negotiated was, rather than having us be committed into that purple category in which we would have to stay for 3 weeks in tier 1, we will be reevaluated on Sunday, this coming Sunday, and a determination will be offered on Monday of what our new tier is. And it will be that basis where we would stay for 3 weeks. I'm sharing here the numbers for that week that they'll be looking at, because we're actually out of that week, because it's looking a week back. And that you can see it's reassuring that our numbers did normalize back to what we had been experiencing before when we were categorized into red. But we'll know for sure when they look at the numbers again on Sunday. Next, please. So there's been a lot of questions about this process, and it's complex, methodologically, and I hope I can simplify it for you. One important factor is that there's the case rates are adjusted. So instead of that raw case rates, the actual number of cases, the state uses something called the adjusted case rate to determine our tier status. And the adjustment is for testing rates. And that's because for any given amount of cases in a community, if you think about it, if you're testing more, you're going to see more cases. And if you're testing less, you're going to see less cases, right? So if you had 100 people and 10 of them were infected, if your strategy was to test everybody you'd see 10 cases. But if you only tested 10 of those people out of those 100, you'd only find one case, right? So your perceived incidence for that community would be based on how much you had tested. Counties that find more, they do more testing, find more cases. So there's a mathematical formula that the state applies for counties with higher testing rates. There's a downward adjustment in their adjusted case rate. And counties that have low testing rate, there's an upward adjustment to their adjusted testing rate. So our number, the coefficient, that's what that's called, that applies for us is about 0.8. So if we have 100 actual cases, it adjusts to 80 cases for the tier determination. But this relies on accurate accounting of all tests performed and not just cases. And that's been one of the issues, is that we have a lot of testing. We have one of the highest testing rates in the state, and we have tests that occur in a variety of different settings. Our hospitals do testings, our clinic do testing, we have multiple private companies that do testing, and then we have the public health testing, which happens at 3 different laboratories. The variety of those inputs sometimes fails to capture every single test that has occurred. And so that's one of the problems with what occurred last week, was that there had been incomplete data for our testing rates in Marin County with the week that they looked at. And so we were able to work with them through an adjudication process to actually correct that, so that we have complete testing rates that applies to our numbers. So it's a better, I think we were able to have them pause, allow us to share the complete data that they had not seen, and work with them to fix that process ongoing. So again, it's an example of how this is a very dynamic space, especially when they introduce a new framework. There are growing pains, and we were fortunate that we have good descriptive capacity within Marin County to actually see issues like that, so we can bring them forward and be reevaluated this week. Next, please. This is another factor of the blueprint. Starting in October, we need to make sure that a minimum proportion of tests must be performed in low-income communities. And that's just to make sure that we're looking at this from an equity lens. This is the way that we have been approaching our outbreak response in Marin County. We have been doing high rates of testing in the Canal area of San Rafael, for example, in Novato, areas where we know the virus is most active in our community, and also our lowest income communities. Counties that are not meeting that criteria of really aggressive testing in those communities that are most highly impacted, which are the lower income communities, would not be allowed to move forward through the tiered framework, even if their other numbers met that criteria. So fortunately, our testing strategy is aligned with the intent, and we will continue to be testing in our low income communities. Next, please. So just briefly, our anticipated reopening. So we did open on August 31st in Tier 1 hair salons, indoor barbershops, indoor shopping centers, and libraries at 25% capacity. Next, please. And then moving into Tier 2, these are the things that we can open if we get the green light for red on Monday, and the numbers are looking good. Indoor restaurants at 25% capacity, indoor shopping centers would increase to 50% capacity, that's the indoor malls. Personal services indoors, nail salons, estheticians, etc. Museums, zoos could open at indoor capacity at 25%. Indoor places of worship can open at 25% capacity, or 100 people, whichever is fewer. Movie theaters, similarly. And then gyms and fitness centers can open indoors at 10% capacity. And libraries can increase their capacity to 50%. Next, please. Finally, for schools, we are committed to reopening our schools as safely as we can. We share a commitment with the Marin County Office of Education to ensure that every child has the opportunity to have the highest attainable standard of education. We know that the distance learning options have been unfortunate for many. And we've worked very closely with the schools, Marin County Office of Education, to develop a 30-point set of recommendations for schools to ensure that they have all the standards and procedures and practices in place so that they can reopen safely. We are in the process of right now being in tier 1, that the schools can open to classroom-based learning only through a waiver applied to the public health officer. I have reviewed and worked with the schools through our public health nurses with 27 schools, and those schools have been approved locally to be allowed to reopen to classroom-based learning. They have testing capacity, they have the standards, they have the disinfection practices, social distance practices, et cetera, that have been verified through that attestation of the school site-specific protection plan. Some schools opened this week, others are planning on opening next week. If we attain that red status, that tier 2, after 2 weeks in red, schools can open to classroom-based learning after they've submitted the school site-specific protection plan to Marin County Public Health, even in the absence of the waiver process. And that's one of the key features of moving into that red status is the possibility to reopen schools, both elementary schools, middle schools, and high schools. Next, please. Any questions? That's a lot of information. The website, the California has developed a good website for anyone who wants to know more specifically about what sectors may be open in different counties according to their tier status at covid19.ca.gov. You can see where we are with regards to our numbers on any given day. And if you have a question about what sector may be open or closed in that county, just type in Marin, enter the activity or the sector, and it'll tell you whether or not it's open or closed and to what capacity. Next, please. I'm just going to end with just a quick update on some of the research and surveillance activities, because I think this is kind of interesting, and that as we work together, we're actually, Marin County is participating in helping build the knowledge base for COVID-19 nationally through some research initiatives that we've entered into. One is with the California Department of Public Health. We're doing surveillance testing. We work to estimate community transmission levels by sending samples to the California Department of Public Health. And that is also going to help us determine when we're seeing COVID-19 and influenza co-infection. So they are going to be testing our samples, a certain number of samples, just as a representational number, for the presence of influenza, because when we start seeing influenza transmission in the community, that will be an important sign to us that we really need to make sure that everyone is fully vaccinated, that our hospitals are prepared for surge, and we'll detect that through this initiative. We're testing wastewater for COVID-19. It turns out that COVID-19 can be passed through fecal material into the waterways, and sewage. It can actually be an effective way to do surveillance for COVID-19. So we have several testing sites throughout the county for that. We're working with the Chan Zuckerberg BioHub to do some genome sequencing to identify where clusters might occur. It turns out there's enough difference between different little strains of COVID-19 where they occur that you might be able to see where someone might have infected someone else, because it's the exact same genome. It's a clonal type that can actually identify small clusters of transmission, working with UCSF on that. And then finally, the Centers for Disease Control and Prevention has an epidemic intelligence service officer here in Marin now, these 2 weeks, doing an assessment as a part of a national program assessing contact tracing efforts across the nation, 10 different counties, and through our relationship with CDC, we were able to have that person come here and assess our contact tracing efforts that will help us do even better. Next, please. This is just to flag that this is going to be an infographic and a tool that's placed on our website. It reflects our commitment to, as we reopen, really making sure that people understand their own personal responsibility. We're moving from a framework of where it's all policies and guardrails placed by public health in terms of orders and limitations, where there's going to be more and more responsibility in all of our behavior. Just because it's open doesn't mean it's safe. As we reopen restaurants, as we reopen movie theaters, that's not necessarily a sign that that's something that we should all engage in right away, right? We need to make more informed decisions, and understanding our own personal risk is important. I'm not going to go through all of these for this in the interest of time, but wanted to signal this as a set of decision aids for us as we try and navigate these personal choices around where we might travel, where we might recreate, and how we might do that safely. Next slide, please. And these are some of the other. This has two. This is an infographic that would again be posted on our website and will guide some of our collective decision making. Next, please. And that concludes my presentation. Thank you. And then we'll get into questions after Benita's presentation. I'm going to now introduce my boss, my boss, Benita McLaren. Benita is the Director of Health and Human Services and has been just a huge asset to this county since she came on board about a year ago. Thank you.
Thank you, Dr. Willis. I do want to take a moment to really commend Dr. Willis for his leadership throughout the COVID pandemic. We are so fortunate here in Marin County to have a tremendous leader, physician, epidemiologist, and scientist combined in one. And thank you, Dr. Willis, for hanging in there, which is unquestionably one of the most difficult times in our history, and you've done a terrific job. So thank you so much for your leadership. I'm going to go ahead in the interest of time, so we have a few minutes for questions, and jump right into just a couple of updates that I'd like folks to know about some of our other work in Health and Human Services. So next slide, please. So I just want to remind everyone of our mission here in the Health and Human Services Department. Marin County is to promote and protect the health, well-being, self-sufficiency, and safety for all people in Marin County. And this is why we're here. This is why we took on this effort. This is what we are impassioned to do. And I want everyone to know in Marin County that all of our over 700 employees are really committed to making sure that we fulfill this mission and this promise that we have. As most of you know, the Health and Human Services Department does have 4 divisions: administration, social services, public health, and behavioral health and recovery services. Next slide. Yes, next slide. And as you all have just heard, because of our deep mission in Health and Human Services, we're very busy and very active throughout the pandemic. As you already heard a little bit about public health, but we're going to hear a little bit more about behavioral health and recovery services, social services, and some of our other programs that have been supporting the COVID response. In addition to those divisions, we have also mobilized a HHS Department Operations Center, also called our Incident Command Team, that has been working diligently day and night during COVID response to make sure that our staff in HHS can continue with the support that we need, including including coordinating communications, ongoing operations, identifying and adjusting to operational challenges and needs to change, conducting ongoing analysis so that we can make changes, coordinating disaster service worker staffing to needs that are out there, and supporting facility closures and openings when needed. Next slide, please. Public health, you've already heard a lot of the great things that Dr. Willis mentioned that are happening in public health. And again, I just want to reiterate, they are just working day and night, making tremendous personal sacrifice, as well as doing tremendous effort, heroic efforts to keep our community safe and healthy during this pandemic. They're working on things regularly, daily, in terms of changes in policy, updating changes in policy, working with our business sector and our healthcare sector, schools, et cetera. They have done community-wide testing, first including the state's first drive-through test site. About the ongoing contact tracing, outreach to different populations. They've been involved in healthcare preparedness through our hospitals, skilled nursing facilities, our clinics, jails and prisons. They have done community-wide and neighborhood level outbreak response. They've coordinated different teams to go out. They've worked with the state and our regional partners to ensure that we have the latest information, and they have provided ongoing support through their normal programs, such as our Women's and Children's program, and also have provided a call center for COVID information. Next slide. Our social services department has also been tremendously active, supporting our community through COVID, and they have approved over 6,000 applications for programs such as CalFresh and Medi-Cal. Over 50% of those new applications have been for our CalFresh nutrition program, and this is at least a 25 to 30% increase over normal CalFresh applications. These households have received even additional benefits. The state has approved additional benefits for CalFresh recipients, adding to over $600,000 over this 6-month timeframe for these recipients. They has also added over $1 million to our community in terms of spending. The CalFresh benefits are also been made available to our fire and our PSPS affected households. Our general relief program has also approved over 175 persons to receive financial assistance during the pandemic, and our CalWorks employment services housing program has been expanded during the pandemic, which has allowed 13 families to receive shelter at hotels with this funding. And this is separate funding from the Project Room Key, which I'll talk about in a minute. There's an additional, I think that's a typo, but I think there's 21 families who have found housing with help through this program, through getting help with deposits, first month's rents, and other assistance. Next slide, please. Social services continues to provide support through our Aging and Adult Services program. They've distributed over 900 shelf-stable emergency box meals through Meals on Wheels and to Meals on Wheels clients and to 8 senior housing sites. Our Children and Family Services program is working with foster families on identifying homes that are available to youth who come into foster care who are either COVID exposed or COVID positive. Our Children and Family Services is also working with public health to achieve more rapid COVID testing for foster youth when they're first placed in our foster care. Our Workforce Innovation and Opportunity team secured $68,000 from the state for a snapback assistance program that provides up to $800 for eligible residents during COVID. And our Career Point Marin Center Resource Center is open now to provide career and employment services, including job search and unemployment benefits for those affected because of the COVID economic impacts. And we also have a virtual job readiness workshops that are available and being offered through the Career Point North Bay. Next slide. During our COVID response, we also have successfully housed over 100 COVID vulnerable individuals and families in motels with Project Room Key. This is a state program, and during this time of those over 100 vulnerable families, over 20 of those families of those 100 people, over 20 families have been placed in permanent housing or more stable living conditions since COVID. And this includes those 13 in the HSP program. And we continue to support over 70 individuals remaining and currently remaining in the motels, and we're currently working on a path for housing for those individuals. Marin County has made proposals through the state through the new Home Key project. And one of those proposals has passed the initial hurdle. The others are still under consideration. And this program is going to allow the county to potentially procure a motel or other facility to house more homeless residents in temporary shelters in the short term and ultimately in permanent housing. And so this is a great win here in Marin County. The county has also placed sanitation stations for the unhoused homeless throughout the county during the pandemic. Next slide. In our behavioral health and recovery services, they have remained open throughout the pandemic, providing mental health and substance use support and services throughout the pandemic when it was most needed. One of the things they've done exceptionally well is they shifted to telehealth, either to telephone or video with therapy clients during the shelter at home order, and they've had many positive results. They've been able to expand their provider network, allowing for approximately 30 to 40 new referrals within our specialty care network. They've transitioned our Spanish-speaking parenting group to virtual meetings, and they are partnered with the Body Heart Community Radio, providing information on COVID-19 to Spanish-speaking community. They've also partnered with Community Action Marin to establish a Spanish peer warm line, and they continue to support the community through mobile crisis unit and through our crisis stabilization unit. Next slide. I also just want to let everyone know that there are many resources that are available through behavioral health right now, including our new community events page that you can see at this website. You can also get tips for coping with COVID on our marinhhs.org coping COVID-19 website. We've also launched during COVID our suicide prevention plan, and we've started our collaborative meetings and community supports. So please go look for those wonderful resources. Next slide. I just want to remind everyone as I get ready to close my remarks that throughout the COVID response, we have continued to work here in Health and Human Services on our equity strategic plan. We are committed to this work where we are leading with race. We believe that is critical throughout COVID, that we stay focused on our equity challenges here in Marin, and that we move forward with our plans to build a more equitable community. Next slide, please. This is just to show some of the strategic planning work that we have started and that we are continuing. Next slide, please. And that we have 6 major priority areas that we are working on through our strategic planning efforts, all supporting our most vulnerable communities that are greatly impacted through the COVID pandemic. Next slide. And one of the things that we're doing as part of our equity work is building capacity within our department so that we can be prepared to meet the needs in the community, no matter what the event that may occur. And next slide. As I close, I really want to thank the community for their continued support of Health and Human Services. I remind everyone that, COVID is still in our community. It is still rampant. I ask that you would please do those things that we've asked everyone to do, including wearing a mask, maintaining your physical distance, making sure you maintain your hygiene standards, and please, please get a flu shot, a regular flu shot this season. So back to you, Lainey.
Awesome. Well, thank you very much, Dr. Matt and Benita, for that comprehensive update. For those of you that are just joining us or maybe tuned in a little bit after the start of this video, this is our community conversation event hosted by the County of Marin and Marin Health and Human Services. And we are joined today by Benita McLaren, Director of Marin and Health and Human Services, as well as Dr. Matt Willis, Marin's Public Health Officer. Okay, now let's dive into the questions that were submitted by our local residents just before the broadcast began. So some of these questions may just be a quick yes or no answer. Some of them might require a bit of description. So Dr. Matt, I'm going to go ahead and start with you. Over earlier this summer, you mentioned to us that there was this magic number of 19. 19 cases per day on average was what it was going to take for us to get off that former county monitoring list in order to reopen our schools. So if I heard you correctly, with this new blueprint, there's no longer a single number that we're looking for given the adjustment factors and the tiers within the framework. Or is there still a magic number that our public should watch out for?
Yeah. Well, there's no magic number. I mean, the most magic number would be 0, and we'll get there eventually. But there are some important numbers that for us to keep in mind. The 19 is actually still a really important number for us because it does correspond to that 7. So if you think about Marin County has 260,000 residents. It's 7 cases per day per 100,000. The reason they standardize it to per 100,000 is that you can then compare counties of any size across the state. So if 7 plus 7, that's 200,000 plus 3 or 4, that gets us to 18 or 19. So 18 or 19 cases per day on average in Marin County is that number, which would actually be, above that would be more than 7 cases on average per day. What's new is that we have that correction factor that I just described, where the more testing we're doing, the more credit we get, we can actually get, they might adjust us down to beneath 7, even if our raw number is above that number.
Okay. In your presentation, I know that you explained to us that adjusted case rate, and it sounds like percent positivity is still a factor in determining a county's placement on the blueprint as well. We had a number of people write in to ask you to explain how in the world is percent positivity calculated. Is that something you could give us a quick overview of?
Yeah, I mean, the concept is, percent positivity is the total number of tests that have occurred. And then that's the numerator. That's the denominator is the total number of tests that have occurred. The numerator is the number that are positive. And that's an important metric for us to follow, because if you think about it, if we had 20% positive, that's a sign that we need to be testing a lot more, and B, that we're probably seeing more virus transmission. Right now, our countywide percent positive is about 4%. We need to keep that beneath 8% to stay out of that tier 1.
All right, that's helpful. Thank you. Okay, so, it was very encouraging in your presentation to see that Marin's COVID numbers have improved over the past several weeks. So I'd love your opinion on what you believe is driving that success, and what do we as a community need to keep doing in order to keep our numbers down and to drive them down even further?
Right. I mean, we really do need to, also take a strengths-based approach to this and think about what we're doing right? Because we have seen dramatic improvement. We had more than twice as many cases at the peak in July than we're seeing now. We had 33 deaths in July, 19 deaths in August, significant improvement, reductions in hospitalization rates, reductions in percent positivity. So what was that, special sauce? What allowed us to do that? And I think there's no magic bullet there. That was really just, or silver bullet, I guess. That was mainly that we were just consistently applying in our everyday lives those practices and behaviors that we know protect us. Physical distancing, covering our face, washing our hands, those things, we've been repeating them over and over and over again. And they do bear repeating over and over again because they are simple, they are effective, and we're learning that when we do them collectively together at a very high level of vigilance, when we're 90, 95% there together, we do actually reduce transmission meaningfully. There's really not a lot of other ways. There's no real treatment for COVID-19. There's some experimental things that may help a little bit, and there's no vaccine. So those are really the behaviors are the main strategy available to us. So when we see improvement, it's to everyone's credit and we all share in both the responsibility and in the benefit.
Excellent. Okay, I'm going to shift gears a bit to a mental health related question. Benita, you mentioned mental health services and behavioral health services in your presentation. There's an educational nonprofit based in Silicon Valley that recently released data that shows that more than half of college and high school students in the US say that they are worried about their mental health and are experiencing anxiety. Nearly a quarter of them know someone that has had suicidal thoughts, and 5% of them, 5%, I should say, have actually made a suicide attempt. So my question to actually to both of you would be, given that we know given this data, how can we continue to keep those classrooms? We know that we have TK through 6, I should say, open through the waiver process. How can we keep those older classrooms of schools closed when there are proven models that are being used in other countries to reopen schools and mitigate the risks that may be associated with that reopening due to COVID-19? And I'm wondering, Benita, you did touch on this a bit. What is being done to address anxiety among teens here in Marin County?
I can definitely answer the piece around what we're doing, and I'll let Dr. Willis answer the first part. But definitely here in Marin County, we're really fortunate. Again, we have a wonderful behavioral health and recovery services department division run by Dr. Jay Africa. And they have partnered with the Marin County Office of Education to provide services for our parents and for our students. One particular program we have is called the MCOE Parent Conversation on Suicide Prevention. And that is held every first Tuesday of the month. And it's an opportunity for parents to come together with one of our outstanding psychologists, Dr. Zuniga. And I also want to mention that these parent conversations are offered in English and Spanish. The other thing that I want to mention, that we have our monthly Marin County Schools Wellness Collaborative, and we have representatives from each school district and from our behavioral health and recovery services at that meeting, with the purpose to strengthen our mental health supports in our schools and to share best practices and leverage all the resources that we have. We're also BHRS is part of our newcomers work group that is led by the MCOE with representatives also from our community-based organizations. And we also we're working with Marin County Office of Education currently on some social, emotional, and learning supports in schools in alignment with our suicide prevention strategic plan. So we are absolutely aware that this is an ongoing challenge in our community as well as around the country, and we want to meet it knowing that a lot of our students are suffering at this time.
Yeah, and I would just thank you for that. Just to add that, to the notion that we're really trying to organize our work around a comprehensive view of well-being, which includes mental and social well-being as well as the absence of disease. And that's part of the continuum of risk that we're having to take into account when we think about reopening schools and acknowledging that there's increasing evidence that a distance learning approach for many students does increase the risk of mental health issues and suicidality, and that's again data that's worth paying attention to. Not that we would just simply return children to school for that alone, but it is an important factor and another driver of our commitment to try and make our schools as safe as they can be and get children back into the classrooms as soon as we're able to.
Excellent. Thank you for that explanation. And on the similar theme of schools, our next question that was submitted it touches on schools. Using data and facts, can you explain how it is that schools can be open, but not businesses like nail salons or other related services? And I believe this is submitted because we know that nail salons have been in an unfortunate position to feel the brunt of the changes from the state, where they were going to be allowed to reopen, then they were pulled back, and then going to be allowed to be reopened again, and it was pulled back. So maybe you can explain how the school classroom environment can move forward, but not some of these other businesses.
Yeah, well, we do, indoor barbershops and hair salons are open indoors. If we move into the red tier, which, I think we want to be clear, our trajectory of improvement in Marin County is well established. We had this week where it just so happened that assessment of our tier designation co-occurred during that window where we had an increase of related to one skilled nursing facility, combined with an unfortunate omission of some of the testing we had done. So we didn't get credit for those. Anyway, we really should, taking a step back, recognize that we're making a lot of progress, and we will continue to make a lot of progress. So, we didn't get into red last week. It's very likely that we'll be there soon. And when that happens, nail salons will be able to open. At the same time, we also don't want to, if we had to make some social calculus around what are the most important elements of stewardship from a governance standpoint and well-being for our community, we know that schools are a key element of health and well-being societally. And so I think we all want to sort of recognize that that's a high priority. It was odd that Disneyland was open and schools were not open. I mean, sometimes we need to take a step back and think, what are our actual collective priorities as a society? And I think we all recognize that if we can get kids back into school, that's important to do early if we can.
Okay, thank you for that. Here's our next question. Interesting one. In Florida, all counties have indoor restaurants and other business open at some level of capacity. Yet case counts, hospitalizations, and death seem to be on the decline in that state. Will California and Marin consider adopting any successful components of states that have successfully reopened their economy while mitigating the spread of COVID-19, like this person suggests happened in Florida?
What I would say about that, Lainey, is, we're really happy to see any state, Florida or any other state, see some success in eradicating COVID. So we're happy if they're really able to make some progress. We're also seeing some improvements here in the state of California. If you look around the state, we're seeing some improvements. But we are really close to work really close with our state public health department. We're very committed to leaning on them. They are very scientific in their approach. They're very methodical. They're very mathematic, and we have a lot of confidence in their ability to give us really good information on how to be safe and how to be healthy. And so at this point, we are really focusing on what we need to do here in California, and we're really depending on the guidance that we get from the state, and we're very confident in the guidance that they're giving us.
We're also seeing the same thing here. I mean, I'll just add to that, and I agree completely with Benita McLaren, that we are seeing reductions in case counts in Marin, and we are partially open. In fact, we are largely open, and I think the strategies that they're adopting in those anywhere where they're successful, it has to do with reducing transmission rates. And the principles of that are the same wherever you are, whichever county or state or nation. And we know what it takes because we're doing it ourselves.
Well, speaking of transmission rates, you mentioned, Dr. Willis, and also Benita, you mentioned the same in your presentation. And we've heard this many times, that one of the most important steps that we can all take is to wear a mask when we leave our home. So one of the questions that we received was asking you to address current mask requirements, especially if you get out of your household or that social bubble. And let's say you're visiting with, I don't know, 2 people, you're social distancing, you're outside. Is it necessary to wear your mask? What's your general guidance on mask wearing?
Yeah, wear it. Yes. So when in doubt, wear it. Even if you're not in doubt, wear a mask. It's a simple thing that we can all do. It's incredibly effective. 95% of the virus particles are reduced by just simple face covering with cloth. It's been, I think it's been one of the most dramatic and unfortunate late understandings in our experience of this pandemic was the effectiveness of facial covering. And so, essentially the only time you would be if you're indoors with your own family members or your own household members, or alone in your car. But essentially when we're out in the community, especially even if you're outside, you should be covering your face, and especially social distancing, still covering your face.
And I would agree with Dr. Willis. I really want to encourage people, please wear your face coverings. I mean, it's not just physically in terms of us trying to keep the virus at bay, but psychologically, when other people see you without a mask, it creates some trepidation and some fear. And so we need to, help our neighbors, support our neighbors and our friends. Please always wear a mask when you're outside, face covering when you're outside your home.
Great, thank you for that. Speaking of mask wearing, I'm curious what behaviors are leading to the new cases that we're experiencing, maybe from a contact tracing standpoint. Is it the lack of masks?
Yeah, we're finding an increasing proportion of our total cases are related to social gatherings. That outbreak I mentioned. I mean, if we think about it, the outbreak that happened in Novato, that long-term care facility, now 5 deaths associated with that outbreak, a major spike in cases. It may be the most single contributor to the fact that we weren't able to move forward last week. It was a staff member who had attended an indoor party in another county. Contact tracing revealed that someone who was at that party indoors was infected. This person who works in a skilled nursing facility became infected, did not realize it, came to work, and launched an outbreak that is now over 100 cases, multiple deaths. So it's a dramatic illustration of the fact that it really does matter, and we're seeing. So that I would say the most important controllable risk factor now for us of transmission is avoiding indoor social gatherings with people outside of your household, aside from what we've always been talking about in terms of physical distancing and covering our face.
And just to remind everyone as well is that if you are, using alcoholic beverages, which sometimes reduces your inhibitions, please don't forget that you're supposed to use your protective covering, your protective facial covering. It's really important, and those gatherings are really should be avoided. Please avoid those large gatherings.
Excellent. Thank you for that advice. I think we have time for just one more question. And so it's also related to the use of face coverings. If everyone does what they're supposed to do, covers their faces and maintains physical distance of 6 feet or more when they're outside their home, are you still concerned about the flu? And do we really need to get flu shots this year?
Oh, that's a good question. Yes, absolutely. I mean, it's promising that the things we're doing to protect ourselves against COVID-19 are, when we look at the Southern Hemisphere, we're seeing a less severe flu season. It's probably attributable to the fact that everything that people are doing in Australia and other places with COVID-19 are reducing flu transmission in those communities. It's a respiratory virus transmitted in very similar fashion. So we can look forward to maybe some of that benefit, but the last thing we need is the co-occurrence of a flu surge and a COVID surge. And we can prevent that. Our hospitals can't manage that surge. And we as individuals, if we get infected with COVID-19 and influenza at the same time, the risk of a bad outcome is much higher. So the solution is really easy, and it's to get your flu shot. And the flu shots are available. Your healthcare provider should have it. Pharmacies have it. Health and Human Services will be distributing flu shots when we have our supply in the next few weeks.
All right. Well, thank you, Dr. Willis. Well, unfortunately, that is all the time we have allotted for today's event. We actually went over by a couple of moments, so thank you to our ASL interpreter for hanging out with us a little longer. I want to thank our panelists today, Bonita McLaren, Director of Marin Health and Human Services, and Dr. Willis, Marin's Public Health Officer, for joining us this afternoon. And I especially want to thank you for watching. This session was recorded and it will be available on demand on Facebook immediately after the conclusion of this broadcast. And English and Spanish versions will also be available on Marin County Government's YouTube channel a little later this afternoon. If by chance your question was not answered and you submitted it before the event, our wonderful team at the COVID-19 response team will be reaching out to you by email in the next day or two with a response to that question. So thank you for taking the time to write. Others that are watching, if you still have a question that has come to mind, fear not, our COVID-19 response team is available to you as well. They're available Monday through Friday, 9:30 a.m. to 12 p.m. and again at 1 p.m. to 5 p.m. by phone. You can reach them by calling 415-473-7191. And remember, you can find all of the latest data, information, and other updates about COVID-19 in Marin County by visiting our website, coronavirus.marinhhs.org. Again, we want to thank you all for joining us today and for watching. We look forward to seeing you again at a future community conversation. Until then, stay safe, Marin.